Hi everyone! Today we'll talk about medications you can get over the counter for common symptoms of the cold and flu. The cold and flu are common illnesses that probably all of us have experienced at one point or another. Both cold and flu have similar symptoms such as sore throat, cough, runny nose, congestion, and fever. These symptoms can start to appear about 1 to 3 days after infection. The duration of symptoms typically lasts from 7 days to 3 weeks. The flu and common cold can both be spread to others and are caused by viruses. Over-the-counter or OTC products are often used to help with the common cold and flu. These medications won't cure the infection, but will help improve symptoms until your body is able to fight off the infection. When using an OTC product, try to relieve the worst symptoms first. I'll be providing a brief overview of specific OTC products that can be used for each symptom. I'll be covering the symptoms of nasal congestion, sore throat, cough, and fever. First, let's talk about nasal congestion, also known as stuffy nose. A stuffy nose is often caused by inflammation or irritation of the nasal tissues, which then makes blood vessels swell and block the airway, causing a stuffy, clogged feeling. For a stuffy nose, you can use decongestants. Decongestants work by shrinking swollen blood vessels and tissues, relieving the pressure and making it easier to breathe. Some common active ingredients for decongestants you see over the counter include phenylephrine, pseudoephedrine, and oxymetazoline. While both phenylephrine and pseudoephedrine are taken by mouth, oxymetazoline is used as a nasal spray. Do not use pseudoephedrine if you have high blood pressure because it can increase your blood pressure. Also, do not use nasal sprays for more than 3 days since using them can make your nose more stuffy and congested when you stop, what we call rebound congestion. Pseudoephedrine can only be found behind the pharmacy counter. If you want to purchase it, please talk to the pharmacy and ask for pseudoephedrine. Next, let's go over sore throat. When we are infected by viruses, these nasty bugs can get into our tissues around the throat and damage our cells. During this process, we feel pain and irritation in the throat, and sometimes it involves swelling. Phenol, glycerin, and benzocaine are common medications that can soothe and relieve throat irritation. They're in a variety of forms including lozenges, sprays, tablets, liquids, examples of which you can see here. These products numb the throat and help reduce pain. Although they are fine products, using a hard candy for sore throat can be just as good as OTC products. So if you want to save some money, you could just buy some hard candies for a similar effect. Next, let's go over cough medications. There are 2 different types of coughs. Wet coughs produce mucus, while dry cough doesn't. So for wet cough, people often use mucus thinning medication such as guaifenesin, while for dry cough, it is best to use products that can help reduce cough, like dextromethorphan. Honey is another good product that can be used for dry cough since it helps soothe the airway and reduce throat irritation. Again, guaifenesin is more useful for wet cough, while dextromethorphan and honey are more useful for dry cough. Some additional tips for a wet cough: drinking plenty of water is as good as taking guaifenesin, so if you have a wet cough, try drinking plenty of water first. Next is fever. When our body is being attacked by cold and flu viruses, our body tries to fight back by increasing our body temperature since these viruses have trouble dealing with heat. However, a fever can be dangerous for our body as well because our cells also can get damaged if the fever gets too high. So when we have a high fever, we use a drug to prevent or reduce fever. The 2 most well-known fever-reducing drugs are acetaminophen and ibuprofen. Their brand names are Tylenol and Advil. Naproxen, also known as Aleve, is a similar drug to ibuprofen but lasts a longer time. Avoid acetaminophen when you have liver problems, since acetaminophen can damage your liver. Avoid ibuprofen and naproxen when you have kidney problems or high blood pressure, since these can damage your kidney and increase blood pressure. So this concludes my overview about over-the-counter medications for the symptoms of cold and flu. Like all other medications, please talk to your pharmacist about whether the medication is safe for you to take. If you have any questions, please feel free to leave a comment down below the video. Thank you for watching, and see you in the next video.